We had a patient about a year and a half ago who sought us out from Seattle. A 26-year-old female, had had 6 surgeries, 3 hip surgeries on each hip prior to seeing us, and just soft tissue work. So they kept going in, fixing the labrum. She kept tearing. A couple months later, come back, same pain, same thing. And she went to a couple different surgeons in Seattle. She found us, and we did a thorough workup in her, and we found not only did she have a labral tear again, but the cause of her pain hadn't been addressed. And she had a complex issue. She had both an abnormality of the socket, where she had a shallow socket. She also had an abnormality from a rotational standpoint of her femur. So she had the way her femur was built, it was abnormally rotated. So her hip wanted to fall out the front, and the labrum just couldn't support her. It was just too weak of a soft tissue to support her. So they kept fixing the labrum, and of course it's going to tear again. And so she needed a complex surgery that Dr. Hugate and I did together, where we went in and I actually performed what we call labral reconstruction, where I put cadaver tissue in and built a new labrum for her. And Dr. Hugate, at the same time, right when I was done, used his skills to both reorient the acetabulum, give her better coverage, as well as derotate her femur and create a normal hip from a bone standpoint. So we'd staged that procedure. That procedure takes about 4 hours or so. She's inpatient, and then about 4 months later we did her other side. She's super happy. She's back to her full activity. She's about a year out, but it was a long road for her. So we see these cases, we see these patients. We're deliberate about our workup and our imaging, and make sure we get the correct diagnosis first, so we know what we're treating, so that we can optimize our outcomes later on.